Hey,
What's going on? Welcome back.
what if it's their first time?
Oh.
So if it is your first time, pause, go back to one of the videos that says start here.
Start here.
Sorry.
Okay. But
Back to it.
okay, yes.
Welcome to Between Two Teeth. We are your doctor hosts, Dr. Stephanie Ganter, who's a periodontist, Dr. Bob McNeill, who's an oral maxillofacial surgeon, and this is Between Two Teeth.
Welcome, guys. What are we going to be discussing today?
We are going to talk about difficult patients. Now, yes, exactly. These are the patients that you see the name on the schedule and you go,
Is this the one where you're like, oh, him?
Yes, indeed. And obviously it's difficult. I think at times the more experience you have with difficult patients, it can help you out. But then sometimes you get to a point where you just lose patience on your own side of the equation because you're just done with it. And that's difficult.
Would you say we need to manage these patients with patience?
Yes, I would say that. That's very good. Very, very cheeky there.
Very nice.
What I would say, and from a dental board perspective, obviously, I've seen lots of issues where patients are unhappy, and that can cause a board complaint, which is not a good direction to go. We've talked about in other videos about patient communication, and oftentimes effective communication can help with that. But sometimes it can't. Sometimes you have to let the patient vent, figure out how you can protect yourself and your staff, and figure out, does it make sense to treat the patient that day or not?
Well, when you bring up protecting yourself and your staff, what do you mean? Talk more on that.
So I would say, for instance, if someone's getting violent, and I've had patients go that direction and trying to figure out what's the best way to manage that. I think a lot of times a doctor getting involved and say something like, we will not tolerate that type of behavior here. I understand that you are angry. This is using that labeling technique that sometimes we talk about. But we can't have that take place right here. And that's something that can protect your staff, protect yourself.
And I love that comment because a lot of times, especially as a new doc, I don't know where to start. What can I say? What can I not say? Other than literally just to almost take the abuse.
And you don't want to be abused by a patient. You don't want a patient to abuse your staff. And labeling is a psychological technique that can help and to help diffuse a situation. And that's where I understand that you're angry about what happened here. Let me see if I can help sort out this situation. You're trying to calm.
Can you ask a patient to leave?
So you have to be very careful. There are issues from a state board rule perspective where you have to follow certain criteria. Otherwise, you can run into problems with the state board as far as patient abandonment. But even backing it down a touch further, we kind of went right with an aggressive patient off the get-go. I'm even talking about a difficult patient who's just hard to manage in the chair. We know people don't want to be there. They don't want to have a dentistry experience sometimes because of everything they bring to the chair.
Sure.
And I want to talk about a simple technique that I've used a bunch that is really pretty helpful. Are you ready for that?
Not at all.
Not at all. I'm holding the tooth again, by the way. I lost my piece of tape to help hold it there. But here's what I find has helped me in practicing almost 20 years. When I think the patient is profoundly numb, so I don't think it is a numbing issue, and they start moving, and then I'll stop all of a sudden and say, oh my gosh, does that hurt? And they'll make some sort of comment. And I said, well, that's not my intent at all. Let me put a little bit more local anesthetic in here, and we'll give that a couple minutes. And if I can't get you comfortable, I want you to let me know, and we'll bring you back another day and sedate you. Or, I'll come back in and we'll test the area, and maybe we need to send you to a specialist. Now, we're specialists. We want you to send them our direction. However, it gives you a nice chance to have the patient in charge. You're telling them, hey, I don't want to hurt you. I've done a little something extra here, which can be a placebo. The patient feels in control. They want it done that day most of the time. And I find when I say that, I leave the room, I come back in, it's an entirely different patient. They can handle the pressure of a dental extraction, for instance, whereas before I just touch their face and they're freaking out.
Right. That's a great point you just made. And because a lot of times we feel as though, or at least I know I felt as a new doc, if it's not going well, then it's either you got to stop and, but that's going on in my head. I'm not
Right.
necessarily saying that to the patient. When you say those things and you say that thought process to the patient in a controlled manner, you actually give up the power to get more power.
I had at the state board level, had a fairly recent case where that was an issue of the practitioner probably should have stopped the procedure and kept going. And it ended up having a panic attack and a medical emergency, and
When
knowing when to stop.
Right, that is critical.
And it's okay to fail. There are times you have to fail. Me as an oral maxillofacial surgeon, there are times that I hit the pause button and I say, what we're doing right now is not working, and we need to bring you back for a variety of reasons. Maybe
Right.
it's going to the hospital, maybe it's a deeper level of sedation with an additional provider.
And I love all of those points, and I'd love to segue a little bit into what happens when a patient is being difficult in the standpoint that they're not happy with the work that's been done, or the work that's been done, or whatever has not met their expectations. Now, doc, they want their money back.
Right.
How do you handle that?
Which gets into the expectation management talk that we had a couple of videos ago. And it's difficult. If you have a negative outcome, say you do a procedure, things didn't go as planned. You had a root canal with a perforation, and now the tooth needs to be extracted. You're going to be in a different position versus I took out a tooth, everything healed up just fine, and now they're unhappy. You kind of have to take a look at it, take a look at your records, the treatment outcome, and figure out what makes sense.
Right.
There are times that it's super duper smart, if I can use that term. Is that a term?
Smarter.
It's smarter to look at it and say, I'm going to touch base with my malpractice carrier. I'm going to get a signed release from the patient. Here's your money. Let's end care, move on down the road. But these are days that makes what we do super challenging.
Right.
But it also gets back to communication and setting expectations. And unfortunately, when you're a new doc, I had one new doc with a board case that their very first case was veneers 6 to 11 on a patient with a high smile line, very high aesthetic demands. They were right out of dental school. The patient had unreasonable expectations because there was tetracycline staining, host of things that it was kind of set up for disaster at not meeting expectations. And it's okay to say no. It's okay to say, I do not believe I'm going to be able to meet your expectations. I don't think we should do this. And don't let a patient push you into doing something. Once again, from a board perspective, we see that a bunch. Well, the patient wanted me to X.
Right. It's from a new doc's perspective, it's very easy to be pushed into a certain expectation, especially when you're not busy. The only patient on the schedule that day wants the full set of veneers 6 to 11 with the high smile line.
Yeah. You think you hit gold. You're like, woo!
No, you're rolling your eyes in your head going, man, why can't I have the easy ones? But guess what? The owner docs are getting the easier cases, or the cases that are most lucrative. And so it really does pose some unique special challenges. And thank you so much for highlighting some of those aspects.
And I would say, just to wrap things up, surround yourself with good people. When you have a challenging patient, talk to other docs. If you've got other docs in the practice, talk to your friends. It's nice to have a peer group. And if you're a new doc, to talk to new docs about their challenges. But it's also really good to have someone who's been out 10, 15, 20, 25, 30 years to get their perspective as well. So in closing, if you love what we're talking about, Please hit the subscribe button wherever that is down there. Leave your comments about some topics that you want to hear about. And thank you for joining us.
Thanks so much, guys. This has been Steph and Bob on another episode of Between Two Teeth. Thanks for joining. Okay.